Okay, in this video, we are gonna go over a hip distraction using a mobility band here, pretty thick one, so the thicker the better, because, well, not only for comfort, but just the intensity of the pull we're looking for to distract the hip joint, just to give you a little bit more space in there when you're going into a flexed position. So basically what I'm gonna have you do is make sure it's at a relatively low anchor point, because we're gonna do this distraction in a child's pose position. So you want this to be, at a lower point. And then I want you to angle your body just slightly at the same direction as the hip we're focusing on. So in other words, I'm kind of diagonally to the right and I'm working on my right hip. Make sure this is up as high into your crease, your hip crease as possible. And I want you to kind of crawl a little bit forward until you feel a pretty decent pull. Because once you rock back into a child's pose, it actually takes away some of the slack. So basically, if you have pinching in the hip in a squat position, in a lunge position, that's when our hip is in flexion. So basically, being in a supported position as we're getting traction, aka child's pose, we're still getting the hip in a very flexed, deep flexed position, not under load. So this band is helping getting some space in the hip joint. Again, make sure it's a pretty decent pull, but not so much so that you're in pain or discomfort. And then I want you to rock your butt back to your heels. Stay there for a few seconds, maybe like 5 to 6 seconds. Come back forward, maybe squeeze the glute a little bit on the way at the top. And then come back, let that band pull. Again, you want a decent pull on the band, so I have to walk forward a little bit when you get in that child's pose. So again, a lot of the times when we get into this deep flex position, sometimes our femur runs out of room in our hip joint. So again, this band is trying to help pull that femur down in the hip socket so it doesn't run into the pelvis and you get that pinching or that blocking sensation. So this is a good mobility drill to do after you check your squat. So check your squat first, see if you're having that pinching sensation, and then maybe try this mobility drill and then retest your squat to see if it helps. If it doesn't, either the mobility drill is not being done correctly or it's just not something that you need and we need to reassess something else. But anyway, this is a good thing to start before doing a low body exercise, and especially if you're having pinching in the hip.